Hi, I'm Manski of the Fones School of Dental Hygiene at the University of Bridgeport. I and my colleagues Laura Greco and Wendy Garcia created this poster entitled Instituting OSCEs for Assessing Competency in Dental Hygiene. The objective structured clinical examination known as the OSCE is an assessment method based on a student's performance that measures clinical competency. In allied dental programs, however, it's rare to observe OSCEs being utilized on a regular basis. Observing that developing skill level as a progression to full competency ensures the educator that progress is occurring, and it provides a consistent standardized scenario to evaluate each student in a standardized evaluation prior to a full competency-based test. Especially during COVID, this really worked out well, that the way that we did this. We used a lot of simulation prior to the actual injection time to their partner patient, and it really did seem to make a difference instituting the standardized simulation and the OSCE. The local anesthesia is a highly technical skill for the student to master. Prior to instituting the OSCEs, a written exam and a pass-fail lab practicum was the only assessment preceding the live injection clinical practicum. Thus, there was a need for an OSCE format so that an additional measurement of clinical readiness could be determined. Further, the need to identify clinical weakness and need a remediation time prior to these injections was crucial to student success and overall clinic safety prior to the final live student partner-based evaluation. Additionally, this technique-sensitive skill is reevaluated during an OSCE reassessment following the winter semester break and prior to the student treating a clinical patient in the spring semester. This allows for technique review, skill maintenance evaluation, unanticipated yet possible remediation to assure the quality of patient care. Methods. In the fall semester, students were exposed to the OSCE format 3 times during the learning process, demonstrating increasing levels of local anesthesia competence at each exposure. There was a lab activity that the students prepared for during an activity rotating through 3 lab settings representing the following skills A through C. A peer student observed the skills, offered suggestions, and recorded notes on a provided OSCE preparation handout. The skill areas were A, the student practiced syringe setup and breakdown with armamentarium based on specific criteria using a ball safety needle. B, using a simulation model head with a typodont, students located target areas with correct injection angulation, described depth of penetration and amount to dispense using a ball safety needle. C, the presentation of a local anesthesia procedure to a patient, which was their patient partner, and a drug screening clearance question that students created themselves with clear, concise professional phrasing containing specific criteria that address the critical need for confirmation of safe patient administration. 2. The OSCE evaluation was performed using the 3 areas above in the lab setting with the following differences. In the A area, a mini case study was incorporated to evaluate the student's choice of correct anesthesia, actual needle size, and demonstrate proper syringe setup and breakdown with armamentarium. In the C area, the student presented the local anesthesia procedure and medical confirmation to the case patient, and the B area remained the same. 3. In the spring semester, a reassessment OSCE, or what we call an ROSCE, was performed by the student prior to patient care. This skill maintenance OSCE was given as a pass-fail in all criteria areas using the same rubric design. Any unsatisfactory result required remediation and reassessment prior to clinical use practice. Results. Student skill performance was observed as more confident and familiar in the OSCE and ROSCE clinical skill assessments. The evaluating faculty noted improved skill and knowledge during clinical practicum and patient care compared to previous years when this model was not incorporated, specifically syringe setup, injection location, and delivery of the patient's script. This knowledge of pre-procedural skills appeared to enhance overall student self-assurance and safe administration. Students reported confidence at chairside and felt that it was boosted, providing a comfortable atmosphere for themselves and their patient during this potentially highly stressful procedure. Upon return to the spring semester, the ROSCE reinforced the need to review this highly technical skill, reinforcing the importance of maintaining competency and emphasizing the need for each criteria area to be supported through higher level critical thinking as advanced assessment level was expected. It was observed that students supported this activity as it mandated course content review, stressed ethical skill maintenance, and prepared the student to re-enter the clinical setting confidently. In conclusion, this model of education has provided successful as the students became familiar with the OSCE format, the grading criteria rubric presented during the 3 levels of competency, the lab, the OSCE and the ROSCE, allowed the students to move through the levels of learning with achievement. Using the OSCE format in these 3 stages provided valuable information on student readiness and maintenance of skill performance, allowing the course director to evaluate teaching effectiveness and skill retention. Communication to both students and faculty was enhanced as areas in need of strengthening were identified and reinforced. Thus, providing the OSCE assessments assured consistency and competence from beginning to mastery. Thank you.